This is a short presentation about how we can protect ourselves and others against the coronavirus, COVID-19, when we are shopping or delivering food to those in self-isolation. If you are volunteering or organising volunteers, it is vital that we stop and think and make sure that we are doing everything we need to protect ourselves and others. The first thing to do is to wash your hands regularly and properly. Use hot water and soap and wash your hands for at least 20 seconds. This is particularly before handling food, before and after shopping, before eating. Always wash your hands before going out and when you return home. Follow these important steps. Use a hand sanitizer or gel if soap and water is not available. If you sneeze or cough, do so into a tissue and dispose of it straight away. If unable to get a tissue, cough or sneeze into your elbow and never sneeze or cough into your hand. Of course, after handling a tissue, wash your hands. Although it can be difficult, try and not touch your face, particularly your nose and mouth area. Here are the main steps you need to follow when washing your hands properly. Wet hands. Apply soap. Rub hands palm to palm. Lather the back of your hands. Scrub between your fingers. Rub the back of your fingers on an opposite palm. Clean thumbs. Wash fingernails and fingertips. Rinse hands. Dry with paper towel. And use the paper towel to turn off the taps. When should you wash your hands? When they look dirty, after arriving home, after coughing, sneezing, blowing your nose, after going to the toilet, before and after preparing food, before and after eating food, after being in contact with animals, animal feed and animal waste, after touching waste, when taking care of sick people, after changing nappies or cleaning up a child, before and after treating wounds, before inserting or removing contact lenses, when using public transport, at the hospital and at the doctor's office, when using touchscreen, when using potentially contaminated objects in public places. Before entering the store or supermarket, observe any measures that have been put in place to ensure social distancing. Once in the store, continue to practice social distancing, leaving at least 2 meters between yourself and other shoppers. Be guided by store staff and follow their guidance and observe areas where tape has been used to mark out 2 meter spaces, particularly at the checkouts. Consider wiping shopping baskets or trolleys with disinfectant wipes, or use disposable gloves to handle food or food packaging. Pay for shopping using a card, and it is preferred to use contactless. On leaving the store, use a hand gel sanitizer. Delivering shopping and medicine to those in your community. Remember, once you have finished shopping and you have left the store, either wash your hands with soap and water or use a hand sanitizer. When dropping off groceries or medicine, there are a few things that need to be done to keep yourself and the person at home safe. It is advised that prior to dropping off items that you phone ahead and let the person know that you're about to drop off their food or medicines. Remind them that there can be no physical contact between you and them. Explain that you will leave their items on the doorstep and that you will phone them once the items are on the doorstep and you have stepped back at least 2 meters. Once you have dropped off the food or medicines, make sure the person has collected their shopping bag from the doorstep. Advise the person when unpacking their shopping that all food and drink packaging made from plastic, glass, cardboard or any tinned items should be wiped down with a diluted household bleach solution or with a disinfectant wipe and stored appropriately, e.g. in the fridge or freezer if required. Let them know that they will need to clean the plastic shopping bag, including the handles, with a diluted household bleach solution or if made from material, it should be washed at 60 degrees centigrade. Paper bags should be recycled and disposed of in the appropriate recycling bin. Remind them to wash their hands once they have put their shopping away. Check with them that they don't need any other help, and if required or appropriate, signpost them to where they can get further help. For more information on hand hygiene, food safety and nutrition resources, please visit the following websites. This podcast was produced by NHS Forth Valley Nutrition Dietetic Health Improvement Team. Visit our community nutrition website for advice and information on nutrition and healthy eating, downloadable resources and links to useful websites. www.nhsforthvalley.com/nutrition.